Good afternoon. Thank you for allowing me to talk today. I'm going to talk to you today about Lyme and co-infectors and how, whether they can play a causal role in cancer. So to begin, you're probably wondering how a conventionally trained oncologist ended up as a Lyme literate doc. So I just wanted to give you some background about my story so you understand it. So I grew up in New York City, Queens actually, and then did all my training in Manhattan and Mount Sinai Medical School after going through a pretty intense 7-year program. And then I went to internal medicine in New York Hospital Cornell. And then I got very much interested in cancer medicine, so I went right across the street to do a fellowship at Memorial Sloan Kettering Cancer Center. And then I pretty much had enough with Manhattan, and then I moved up to Syracuse, New York, and I found a large group practice, and I was able to practice conventional hematology and oncology in adults, which was a great experience, and I thought I'd be there for the rest of my life, but the universe had other plans for me. And so when I was at HOA, personally, I had some issues balancing stress, and it was very scientifically oriented. And a good friend of mine said, "Well, why don't you see a spiritual healer and try some other things?" So I said, "Okay, I'll try to be open-minded." So I had Reiki done and chakra healing and deep meditations, and it completely expanded my my brain to understanding what we consist of as humans. So I got very much interested in integrative medicine. And so I went through a program through Scripps Clinic, and then University of Arizona, I did a 2-year fellowship in integrative medicine with Dr. Andrew Weil. And at that point, I started to see the deficiencies in oncology and how we treat patients in the short period of time we have to treat people. And I wanted to talk to them about them as total humans, not just seeing a disease that we need to treat with chemotherapy or radiation. So I actually met Dr. Ronald Stram at a conference, and he was looking for an integrative oncologist. And so I decided to leave Syracuse, at least commute to Albany for a couple of years and be an integrative oncologist, but also broaden my integrative medicine practice. And there I found out that Lyme disease was a big problem, and the Stram Center dealt with Lyme disease. And so when I was there, I got trained, and I went through, and now I'm members of ILEDS, and I got precepted with Dr. Richard Horowitz. And then I realized as I was seeing patients and learned about it that, a lot of my symptoms that I was dealing with over the last couple of years was really a mystery, and I questioned maybe I had Lyme disease. I had a lot of muscle pain and a lot of fatigue and a lot of, then I started to get a little bit of brain fog. I didn't concentrate as well as I did. So I said, I'm just going to send a IGeneX test off for myself. And then I got the result back, and it was markedly abnormal. And so I said, wow, this is what I'm dealing with. And so I was able to treat myself with some assistance, because doctors shouldn't treat themselves. And so, but I used a combination of antimicrobials and herbs, and so I felt a lot better. And I think that's why the universe pushed me there, because I really had no idea about this epidemic that was going on. And then I wanted to come back home to Syracuse, so I opened up a practice in integrative medicine, so integrative medicine in central New York, and we're in Chittenango, about 20 minutes from Syracuse, and then Dr. Amy Lazzarini also recently joined our practice. So I wanted to just briefly touch upon what integrative medicine is all about. So it's a collaborative, holistic approach where we actually spend more time with patients, because that's really what's needed for healing. It's not just a disease-focused approach. It's approaching the whole person, body, mind, and spirit, and again, it's a partnership with patients. And it doesn't reject conventional medicine. That's an important point. But we also don't accept alternative therapies as being true without really scrutinizing data. The importance is also that we use evidence-based remedies, but they're not only from randomized controlled clinical trials. It's healing-oriented medicine, it's patient-empowering, like Hillary had said. And again, like Hillary said, it's enhancing the terrain of the body. It's looking at, not a disease process, but what context is that disease process in? So, balancing hormones, decreasing oxidative stress, detoxification, looking at the immune function, trying to strengthen it, decreasing inflammation, and looking at nutrition and digestion, making basically that terrain less hospitable to illness. So infections have been shown to be linked to cancer. We have a lot of data on this. It started in about 1911 with Peyton Roos. He was the first person to show that cancer can have an infectious origin. And he took a sample of a chicken who had a sarcoma and took a little bit of what we call cell-free aspirin, just some plasma, and he injected it into another animal, and lo and behold, they also developed a chicken sarcoma, at least a sarcoma. And it was later identified to be what's called a Rous sarcoma virus. Basically, it was an RNA virus that could then initiate cancer. And he later did get a Nobel Prize for this. So this initiated, like in the 1950s, a lot of growing interest was in infectious diseases. We started developing antibiotics. Anti-TB drugs were used widely. The structure of DNA was discovered. And the electron microscope was developed, and viruses could actually be seen. So between 1951 and 1972, there were now 26 mammalian oncoviruses discovered. And oncovirus is any kind of a DNA or RNA virus that can basically insert its RNA or DNA into a host cell, a chromosome, and then initiate a cascade of cancer by establishing some mutations and then making some viral proteins in the body. In the late 1960s, the United States had the U.S. Virus Cancer Program initiated, and then there was more and more growing research that several viruses, bacteria, and parasites can cause cancer in humans, and this provided new opportunities for cancer prevention and treatment. In 1997, the World Health Organization stated that up to 84% of certain cancers are caused by viruses, bacteria, and parasites, and that more than 1.5 million new cases of cancer each year could be avoided by preventing the infectious disease that was associated with them. And what are these mechanisms? Well, there's production of chronic inflammation by free radicals, then causing damage of proteins and cell membranes, transformation of cells, which we talked about mainly through viruses, these oncogenes, inhibiting tumor suppressor genes, and suppressing the immune system itself. So typically, infectious agents that are linked to cancer are highly prevalent in a population, and they hang around a long period of time. And this is what's known as persistency and latency. So there was an important paper published in the year 2000 by Cooper et al., and they made a statement saying, following tobacco use, infections as a group may be the most important preventable cause of cancer in humans. So infectious agents alone is not what's needed. There are some other cofactors that are vital to propel that towards cancer causation. Persistence of the infectious agents is needed, and as we stated in viral infections, we have the mechanism down pretty good, that there's infection actually of the precursors, what are called the pluripotent cells of the malignant cells, and then they lead to some Xerox copies down the line, causing viral genes generated in tumor cells. And again, on tumors due to infections, we see monoclonality, and that's again, these Xerox copies, origin in a single cell. Established oncogenes and oncoproteins are primarily limited to viruses. For bacteria, we don't really know of any oncogenes, and most of the evidence from causality in bacterial infections actually comes from epidemiology and limited molecular biology studies. We know that parasites can have oncogenic potential, and they can persist in an individual, and we know that removing the parasite may actually reverse tumor development. We know that finding the infectious agent in tumor tissue doesn't necessarily prove that caused the cancer. To prove cause and effect, again, you need these additional studies, epidemiology, microbiology, and molecular biology techniques. So there's certain viruses and bacteria that cause certain cancers that are well delineated and that many people know about. So I just wanted to kind of go through those. You've probably heard of at least some of these. Hepatitis B and C virus are sexually and bloodborne transmitted pathogens, viruses that can lead to chronic liver disease and chronic liver damage, and in some cases can lead to liver cancer, known as hepatocellular cancer. The Epstein-Barr virus, which is actually in the herpes virus, most of us are actually positive for Epstein-Barr virus, about 90% of us. And but the thing with Epstein-Barr virus is in many of us it lies dormant. Some of us get stressed during college years and come down with infectious mono, so EBV is the cause of that. But EBV also can cause certain cancers. It's well known that it is linked with Hodgkin's lymphoma, Burkitt's lymphoma, which is quite an aggressive lymphoma, diffuse B large cell lymphoma, something called nasopharyngeal cancer, and then less well-known link is gastric cancer, something called pyrothorax lymphoma, and leiomyosarcoma, which is a cancer that is derived from the muscle tissue. Human papillomavirus, or HPV, is sexually transmitted, most notorious for causing cervical cancer, but we're seeing more and more cases of head and neck cancer related to HPV, and they actually have a better prognosis. We see vulvar, anal, and penile cancers due to HPV as well. Human T lymphotropic virus, or HTLV1, can cause adult T-cell leukemia and lymphoma. And there's a human herpes virus 8, otherwise known as HIV-1, that can cause AIDS-related cancers like Kaposi sarcoma, some B-cell lymphomas, and something called primary effusion lymphoma. And then you all are probably familiar with Helicobacter pylori, or H. pylori, and this has been linked with gastric cancer, as well as what's called MALT lymphoma, mucosa-associated lymphoid cancer. So there's also infectious diseases that are a bit less well known that can cause cancer. Human herpes virus 6 can cause oral squamous cell cancer, Hodgkin's and non-Hodgkin's lymphoma, and also cervical cancer. Merkel cell cancer, which we saw very rarely in the world of oncology, we've actually now pinpointed it to a polyoma virus that is inducing Merkel cell cancers. Certain bacteria like Salmonella can cause bile duct cancer and also liver cancer. Streptococcus bovis is a type of bacterium that has been linked to colorectal cancer. And then there are liver flukes. I'm not going to try to pronounce these, but I'll just say liver flukes. And cholangiocarcinoma can happen related to them. Schistosoma are some parasitic flatworms, and these primarily are known to cause bladder cancer, but we've also seen cervical, colorectal, and liver cancers. And then even fungus, like Aspergillus, can cause liver cancer. Trephoremi whippeli is a bacteria that can cause gastric cancer and lymphoma, and then tuberculosis, lung cancer, and Kaposi sarcoma. So what about Lyme disease and the co-infectors? So we shouldn't really be surprised that we're asking these questions. So this is a very prevalent problem, as you know. We're in the middle of an epidemic with Lyme and the co-infectors, and Lyme, as you know, is caused by the spirochete. In my clinical experience of seeing so many patients with cancer and now seeing a lot of patients with Lyme and cancer, I can definitely see that Lyme disease and cancer play permissive roles for each other. And then I started asking myself, can Lyme disease and the co-infectors actually instigate cancer? And so I started to look, is there any research on this? And in 2014, we found there was an important paper published by Dr. Prado from what's called the Invita Medical Center in Scottsdale, Arizona. And he's a physician very similar in practice in what I do. He sees patients with cancer and also infectious diseases. And the paper summarized the relationship of infectious diseases and cancer, and he included data on Lyme disease and the co-infectors. And then he also notes that unlike viruses, which incorporate that DNA and RNA into the cell, bacteria promote cancer through inflammation, in which these mutations are created that then cause gene dysregulation and what he calls just the cell going haywire. So Borrelia burgdorferi, which is a cause of Lyme disease, is a spirochete that can cause some skin conditions. We know it can cause the erythema chronica migrans, or ECM rash. It also can cause something called lymphocytoma cutis and acrodermatitis chronica atrophicans. It's easier to say ACA. So there is an association between having a positive Lyme disease serology, having ACA lesions, and the subsequent development of what's called a primary cutaneous B-cell lymphoma. So that's been well established, and the Borrelia can actually be found in the skin lesions of patients having this lymphoma. Borrelia can induce a strong immune response to itself within the host, but many times is able to resist dendritic cell activation of the host and recognition of its surface proteins, and then can lead to this lymphoma. Dr. Prado and his colleagues also summarized that chlamydia pneumonia, which is another co-infector in Lyme disease, can also be linked to cancer. So this is an intracellular parasite known as a gram-negative bacteria. It can cause infection in about half of the patients that are exposed to it. It's primarily respiratory spread. It's not primarily tick spread, but the problem is Lyme can reactivate a lot of infections that are in the body, including chlamydia pneumonia. It can cause a lot of upper respiratory problems, including pneumonia and bronchitis and even COPD. And he summarizes that it can cause, lung cancer. The mechanism is not really clear, but he postulates that it's due to inflammation, again, with the generation of free radicals, causing tissue damage and specifically DNA damage. And interestingly, this organism favors the lungs of smokers. So maybe there's a synergistic effect here. Mycoplasma pneumonia is also another co-infector we see in Lyme disease. It's called a prokaryote. It self-replicates, and it's a parasite that infects a lot of different vertebrae. Unlike chlamydia pneumonia, it can be transmitted in ticks and can accompany Lyme disease. It can induce genetic instability, and it can actually trigger malignant transformation of cells. And we know that its presence can actually increase the invasiveness of an existing cancer and push it more towards metastatic disease. It can cause gastric and colon cancers, and its mechanism dealing with p53 mutations and also altering NF-kappa beta, creating activation of that, has been well delineated. So both Dr. Prado and I, in our practices, treat patients with cancer and infectious diseases. And what he states in his article is that patients with chronic Lyme disease may not realize their cancer risk. A surprisingly high number of Invitas patients with late-stage cancer test positive for Lyme disease, as well as its primary or secondary co-infectors. And Lyme patients, he feels, are very susceptible to cancer, either by the Lyme disease directly or indirectly, causing three conditions for tumor growth, namely inflammation with production of endotoxins, biotoxins, and neurotoxins, depressing the immune system, and altering the DNA. Dr. Prado in his article states that Lyme is a complicated disease that can lead to cancer through inflammation and carcinogenic toxins, but it can also make the body more susceptible to viruses that cause oncogene changes, resulting in cancer formation. So that's a second mechanism in which it can actually trigger cancer. Lyme disease, as you know, also causes hormonal dysregulation, and many patients end up going down the path of what we know as a metabolic syndrome. And this involves a path basically towards diabetes, with insulin resistance, high insulin levels, and blood sugar management issues, all linked with a higher cancer risk. And if you look at the integrative literature on cancer, this is exactly the environment that cancer needs in order to grow. I want to give gratitude to Dr. Armin Schwartzbach. I was absolutely floored by his lecture at the last ILADS meeting in November in Chicago. He is from Armin Labs in Augsburg, Germany, and he lectured on the role of tick-borne disease in cancer and degenerative diseases. And I want to thank him for sharing these slides, because I think this information is so important for people in general to know, and other oncologists who are treating their patients. So he described several articles or publications on the co-infectors and also Lyme. And what he found was there's also data that Borrelia has been linked with mantle cell lymphoma. So this was a study done by a Danish-Swedish case control study of over 3,000 patients with non-Hodgkin's lymphoma compared with control population that did not have this. And they correlated reports of having been positive for Borrelia exposure and positive serologies of Borrelia. And he found a correlation that there was an increased risk of developing mantle cell lymphoma. So obviously more research needs to be placed to look at this a little bit further. And the interesting thing is what he found was, treatment of the Borrelia many times led to regression of the lymphoma, which is pretty profound information. There was also information about Borrelia in glioblastoma multiforme, and this was published by Alan McDonald. Dr. McDonald did the original work looking at brains of patients with Lyme disease and patients that had Alzheimer's disease. He actually found Lyme organisms in the brains of patients with Alzheimer's and correlates that as a possible linking causation. But in this paper, he reported 5 patients that had glioblastoma multiforme, and in all 5, he was able to demonstrate FISH positivity of Borrelia there. Again, this study doesn't prove that it caused the glioblastoma multiforme, but this should trigger more research to see, could we potentially then treat patients having glioblastoma and neuroborreliosis, treating the Lyme and seeing if there's response of the tumor. And this is important too because honestly we don't know the cause of glioblastoma multiforme. It has a less than 6-month prognosis when left untreated, and in cases in which we treat with chemotherapy, radiation, surgery, the survival isn't much better, unfortunately. And so it's important to look at this and see how we can find causes and postulate maybe cell phone use or EMF exposure, but we really don't know what triggers this malignancy. So Bartonella, we know, is a common co-infector with Lyme disease. And it is also mentioned in his lecture that Bartonella are the only known bacteria that have the ability to produce what's known as angiogenic tumors in humans. So angiogenic tumors simply means tumors that really depend on blood supply and generate blood vessel formation. These tumors many times express a high level of VEGF, and what we see many times in Bartonella, patients that have Bartonella, we measure VEGF levels. So again, this requires further exploration. We know that there was a case of a patient who had what's known as Bartonella Quintana endocarditis, which is basically an infection of the heart and bloodstream due to Bartonella Quintana, a type of Bartonella. And this patient had what's known as a monoclonal gammopathy, and it's a malignant finding in the blood. It can be associated with non-malignancies, but many times it's associated with multiple myeloma and lymphoma. And this patient had treatment of the Bartonella, and his monoclonal gammopathy disappeared. So again, it prompts further research into these co-infectors. Bartonella, also Bartonella henselae, a different strain of it, has been linked to inflammatory breast cancer. So as you know, Bartonella can trigger this blood vessel growth. And patients that have inflammatory breast cancer, when you see them, it looks like an inflamed, infected breast. Meanwhile, there's a tumor sitting, beneath the surface. And what this study found was that they hypothesized that there was an acute inflammatory reaction triggered by the Bartonella infected endothelium, the little blood vessels in the breast tissue, could be a critical initiator for creating the inflammatory breast cancer in patients, and thereby also causing more rapid spread of tumor cells. And this is pretty interesting because Dr. Schwarzbach described a case of a woman who had an inflammatory breast cancer, and she, on biopsy, she asked them to stain it for Bartonella because she had Lyme disease. And what they found was that specimen was teeming with Bartonella intermingled with the cancer cells. And she said, you know, I don't want to take chemotherapy, but, you know, give me the antibiotic for Bartonella. So they did that, and what happened was the cancer shrunk down. So this is really important information, and I don't think many people realize the importance of these smaller, you know, studies that warrant larger studies. Babesia and B-cell lymphoma. So in this study, they found that there was persistent and relapsing babesiosis, primarily in immunocompromised patients, but what they found was that most of these patients had a B-cell lymphoma. And we know in B-cell lymphoma there is significant reduction of function of the spleen, and the spleen is one of the most important parts of our immune system. And we found that you know, maybe there's a correlation with, you know, babesia and low spleen function and lymphoma. Again, just triggering interest for more research. Ehrlichia and anaplasma. These are less common co-infectors that we see in Lyme disease. Many times we see low white counts, low platelet counts, but they've actually found that there are, you know, signs of leukemia in some of these patients. Myelodysplasia, which can be a step before leukemia, and then acute leukemia. And in this study, they hypothesized that with treatment of the leukemia, perhaps using antibiotics effective against Ehrlichia and anaplasma in patients who test positive could have an important role in successful treatment of leukemia. Toxoplasma also is a co-infector that can happen in Lyme disease. This study looked at the incidence of adult brain cancers in countries in which the Toxoplasma gondii organism is common. And they predicted that Toxoplasma could increase the risk of brain cancer because it lives a long time in the brain and it's kind of encysted in there, and it provokes inflammation. And it inhibits actually cancer cells from dying. So they found that infection with Toxoplasma gondii was associated with a 1.8-fold increase in the risk of brain cancers across the population that had it. And they found in this study that toxoplasmosis is an oftentimes overlooked infection in cancer patients. And what they found was that more often than not, toxoplasma can be linked with solid tumor types of malignancies rather than things like leukemias and blood tumors. So Dr. Schwartzbach also described, again, the link with chlamydia pneumonia and lung cancer, but also prostate cancer. And he found a high correlation between mycoplasma infection and several different cancers, including prostate and lung cancer, and also suggested, again, that mycoplasma can trigger more invasion and more metastatic disease. He also noted that chlamydia trachomatis is associated with a greater risk of invasive cervical cancer. Coxiella burnetii causing Q fever is a less common co-infector or infectious disease that we see in patients with Lyme. This has been linked with the increased risk of lymphoma. Dr. Schwartzbach suggested by the end of his talk that, you know, in patients with certain cancers, we should be actively looking for these infectious organisms to see whether, you know, treatment of those organisms can help in terms of those patients healing from their cancers. And so this is a busy slide, but I thought it was important to put up, again, from Dr. Schwartzbach's lecture, in which he lists the lymphoma and the malignancies that were outlined and the corresponding blood tests that would be recommended to test for in patients. So again, this is not common knowledge amongst oncologists, and I think this is crucial information. And in fact, Dr. Schwartzbach wants me this year at iLabs to hopefully, between him and I, to have some more information together and maybe present an abstract. But I think we need to push forward in this kind of research, and obviously it will require attention and funding. He also, at the bottom of the slide, mentions looking at natural killer cells in general, because again, as Hillary mentioned, natural killer cells regulate against cancer, and Lyme and the co-infector suppresses your natural killer cells. So it should make sense that there's a link there. So, you know, Dr. Prado and I, like I said, we have similar practice populations, but there's also a naturopathic doctor I want to mention, Dr. Darvish, who's in Washington. And she also treats a similar population of patients, and I found an article that she wrote in the Townsend Letter that really resonated with me. And I just think the things that she wrote are just profound. And so this was published in the August-September issue in 2015. And what she recognizes is that, when President Nixon in 1971 announced the war on cancer, there was a very targeted approach to using anti-cancer agents without looking at that terrain. And so she summarized this as saying, decades of emphasizing the eradication of tumors as a treatment goal has evidently not provided significant benefit to the obliteration of cancer in general. And she goes on to say that the majority of current conventional and alternative oncologic treatments often neglect possible causative agents, including viruses, spirochete and other bacteria, molds, and other parasites. So we really need to take a new approach. We need to see cancer as a sign of an abnormal terrain. Darvish again emphasizes that an unhealthy state within certain individuals' tissues creates an environment within that body that's appropriate for the invasion of viruses, parasites, and other infections that then are allowed to in turn lead to cancer growth. And she states, I propose that a diseased milieu is the union of contributing factors, specifically psycho-emotional trauma, toxicities, and intracellular spirochetes and their co-infections. Together, these contribute to a weakened immune system, which no longer combat cancerous cells and therefore leads to tumor growth. And when I read that, it really not only resonated with what I'm seeing in my practice, but going through a lot of different energy healing modalities and learning about spirituality and my own transformation personally and in my career, I heard many published accounts and personally seeing patients saying something happened before my cancer diagnosis that was hugely traumatic, or at least maybe not traumatic to most people, but to me was really life-changing. And they actually pinned it down to about 18 months before. So perhaps the stress of that, in combination with these infectious organisms, can trigger that cancer pathway. So, whether you call it chronic Lyme disease or, as Dr. Darvish says, multiple systemic chronic infection syndrome, or MISIS, or Dr. Richard Horowitz refers to this as MSIDS, either way you look at it, it's Lyme disease in association with a multitude of other organisms creating damage in the terrain. As we mentioned, Borrelian co-infectors reduce the number and function of the T cells, which are called natural killer cells. And so these typically fend off cancer development. And the problem is sometimes we can't even get this test done well in labs, or we ask for it and we get back something completely different. So it's really underutilized. The signs and symptoms of late-stage chronic Lyme disease, or MSIDS, may include a multitude of symptoms like chronic fatigue, heart disorders, neuropathy, musculoskeletal symptoms, digestive symptoms, chronic pain, sleep disorders, psycho-emotional issues, and weight and appetite loss. And all these signs really parallel and mimic what we see in symptoms of late-stage cancer patients. And Dr. Darvish emphasizes because these signs and symptoms of MSIS are identical to those of late-stage cancer, the possibility then exists that MSIS plays a pivotal role in the etiology of cancer. Both Drs. Prado and Darvish emphasized that in their own clinical experience, as in my experience, the cancer survivors who were diagnosed and treated for chronic Lyme disease and the co-infectors actually had considerable prolongation of lifespans and significantly improved quality of their life compared with those treated with conventional treatment alone. Also, many patients with cancer that are treated integratively for chronic Lyme disease had resolution or stabilization of their cancers. So there are some links and similarities between giving chemotherapy and giving antimicrobials, antibiotics. So several chemotherapies, including cisplatin and adriamycin, can actually kill bacteria. The question is, can they kill spirochetes? We need data. I don't think it's out there. They can kill yeast and mold. Certain antibiotics can induce self-destruction, what is known as apoptosis of individual cancer cells. And the question is, can we then use them to decrease cancer risk? So for example, and even antifungals, we have ketoconazole that we typically use in metastatic prostate cancer. Antifungals and antiparasitics also can kill tumor cells. So many natural and herbal, what we call quote-unquote antibiotics that address killing bacteria, fungus, viruses, and spirochetes also have anti-tumor activity. And this makes them effective in treating both cancer and chronic Lyme disease and the co-infectors. And that's why I like integrative medicine so much, because you are using these herbals alongside chemotherapy or radiation, even though it makes conventional oncologists very nervous, but we have the data behind it, that it actually helps patients do better. We find it actually helps them to tolerate their treatment better, and it helps improve their outcome. And what is the mechanism of that? Well, these herbals inhibit blood vessel growth and tumor replication. They decrease inflammation and actually suppress VEGF. They cause cancer self-destruction, and they reduce platelet aggregation. We know platelet aggregation correlates with an increased precancerous state. And they also help to protect the liver and kidneys from chemotherapy. Isn't that great to be able to do that? So there's many herbals out there that have these activities, and andrographis, olive leaf extract, and berberine are just examples of pages and pages of these herbs that can be helpful. So I just wanted to show you a little summary of some of the cases that Dr. Darvish and also myself, just for example, to see what we're talking about in terms of how these infections and cancer can work together. So she describes a 57-year-old male who had that devastating brain cancer called glioblastoma multiforme with less than 6-month prognosis, typically without conventional therapy, who had survived over 7 years, once diagnosed with neuroborreliosis, or Lyme in the brain, and was treated for Lyme disease and the co-infectors using integrative medicine. She then describes a 58-year-old female who had chronic myelogenous leukemia, a chronic leukemia, for 10 years, and she also had breast cancer. And she had complete regression of both of these cancers after she was diagnosed with chronic Lyme disease and was treated for that using integrative non-pharmaceutical approach. And then I have a patient, a 74-year-old female, who had a low-grade B-cell non-Hodgkin's lymphoma and recurrent stage 2A breast cancer. And she had active, chronic Lyme disease. And okay, so and she had active chronic Lyme disease, and she said, I really don't want to pursue chemotherapy. My docs are telling me to do chemo, and I'd rather you just treat my chronic Lyme disease and let's see what happens. So that was about the time that I, it was actually a little bit before the LymeConference with Dr. Schwartzbach. So we did herbals, not even antibiotics, for a couple of months. And interestingly, she had a pre-therapy PET scan and a post-therapy PET scan. She had significant reduction of her lymph nodes and also the mass in the breast. So although we need more research, and these preliminary, results are just food for thought, we can conclude the following. Patients with cancer should be evaluated and treated for chronic Lyme disease and the co-infectors. And the immunodeficiency that we typically see in chronic Lyme disease and the co-infectors increases cancer risk. In many cancer patients, conventional treatments involving chemotherapy and radiation alone may not be adequate to maximize their quality of life and their survival. And we don't know how this is going to interface with immunotherapies, because now we're really moving more towards immunologic therapies. So just imagine the possibilities of what we can do. The numerous infections caused by spirochetes and other bacteria, viruses, parasites, and fungi found in cancer patients require herbal and/or pharmaceutical antibiotic agents. And finally, cancer should be viewed as a red flag, pointing out a disease terrain, directing the practitioner to evaluate and treat for chronic Lyme disease and the co-infectors. So although we need more data, on cancer, the interface between cancer and chronic Lyme disease. I think the results that we do have thus far are, I would say, pretty profound and pretty amazing. And if I didn't go down this journey into integrative medicine, I would never have known about this. So that's why I believe Dr. Arman is very hopeful that we can spread the word of this. And going back to President Nixon in 1971 when he said, we're initiating the war on cancer, he predicted that by now the war on cancer would have been won. But what we have right now is an epidemic of cancer rates actually rising. And that's, we're seeing a growing population of patients in general, an aging population, and so we're seeing more and more cancer. And by the way, probably going to be seeing fewer oncologists, and that's a whole nother story because the whole system is really burning out our oncologists, unfortunately, and the short visits are really not conducive to healing many times. It's very important that we have this research and have the funding and the education to move this research forward. Thank you.
The rest of the hour will be encompassed by talking about something that we have control over in our treatment of Lyme disease and chronic tick-borne illness. So I'm Amy Lazzarini. I'm a gastroenterologist by training. I also have Lyme disease and many of the co-infections, so I understand what a lot of you are going through on your journey of experiencing Lyme. And I just want to talk a little bit about how gastrointestinal health can affect how we manage our Lyme disease, whether our Lyme disease gets better and manifest as many of the symptoms of Lyme disease. So Hippocrates had it right when he said that all disease begins in the gut. He said that over 2,000 years ago, and I think we forgot about that until recently with all of the research on the gut microbiota and the gut-brain connection and the connection of the gut and the immune system. And as you know, the immune system is so important for the treatment of Lyme disease. It's important that the immune system knows what the invaders are and whether it's something that needs to be addressed and to be tolerant to things like foods that we eat and other things so that we don't end up having autoimmunity or worse yet, things like cancer. So why is gut health important in the treatment of Lyme disease? Well, we know that about 80% of the immune system actually lives at the lining of the gut. And when I say gut, let me tell you what I'm talking about here. It's mostly the small intestine, which is where most digestion and absorption occurs of our nutrients. But also I want to give a little shout out to the colon, which is here. And the reason for that is that's where most of our gut microbiota live. And the gut microbiota, as we're finding, are very important for immunity and for overall health, brain, gut health, everything. So Lyme disease, we know, Lyme disease and the co-infectors, such as Bartonella, can actually infect the gut. They found biopsy specimens with PCR evidence of Borrelia as well as Bartonella in the colons of people who had GI symptoms in Lyme disease, as well as the small intestine and the stomach. So they can cause ulcers, they can cause heartburn, nausea, vomiting, poor appetite, diarrhea, constipation, you name it GI-wise, these bugs can cause it. Now, not everybody has symptoms related to the gastrointestinal tract when they have Lyme disease or one of the co-infections, but you need to be aware that the health of your gut, even if you're not having gut symptoms, is very important to the treatment of Lyme. Okay, I wanted to talk just about a few things related to what affects our gut. I don't know if any of you have ever heard of something called leaky gut. It's pretty commonly said, and thank God the medical literature is now supporting this, but they like to call it increased intestinal permeability, but that's okay. What that means is that there's a breach in the gut barrier, and this is usually due to inflammation of some sort, which either affects the lining directly or it affects the gut microbiota. So these are a few things that can cause it, and I'm going to talk about more of the Lyme-specific ones here. So again, the pathogens like Lyme and Bartonella and probably Mycoplasma and others can directly affect the gut. Other infections like Candida, parasites, Salmonella, anything that can live in the GI tract that doesn't belong there will also cause an imbalance. Another thing is diet. The foods that we put in our mouth 2, 3, 4 times a day can cause inflammation and dysbiosis, which is a gut microbiota imbalance. And that's one of the things we have control over that I'm going to talk about a little bit more in detail. We all know that antibiotics can really wreak havoc with our guts. They affect the gut microbiota, and even though we try to give probiotics and either by mouth or by enemas or use probiotic foods, fermented foods, a lot of times it's something that's really difficult to keep up with during the treatments. Physical stress. So the Lyme and the co-infectors themselves, just from having, let's say, a chronic illness like Lyme, it creates a physical stress on your body, which can also then cause gut leakiness, and psychological stress similarly, because it's really hard to go through something that you feel like you have very little control over. Psychological stress for yourself or your family members who you care about. Other things that are common are nutrient deficiencies, mostly because either our sense of taste is affected or we have nausea from the antibiotics or from the disease itself, or we're having diarrhea and we don't want to eat because we're afraid that we can't go out and live socially. And also because of the inflammation of the small intestine, what happens is we just don't absorb foods as well. We don't absorb nutrients. And we know that the reason we eat food in the first place is actually to nourish our bodies and to nourish every cell in our body. And if we can't do that adequately, it's going to cause issues with nutrients that then affect our immune system and our ability to heal. A few other things on the left may or may not be related with Lyme. Toxins probably. But anyways, we'll move on here. So very quickly, I'd like to just show you, this is the small intestine. This is a close-up. These are the small intestine cells. Normally, it's healthy and there's tight junctions that hold the cells together so that they can decide what to let in and what not to let in. When you have something like a chronic infection like Lyme or others, or other reasons, you can get leaky and inflamed intestinal linings, which then cause increased permeability and trespass of things like microbes and food particles that normally shouldn't be getting in there because they're bigger, or toxins that get to the area where the immune system lies. So there's immune system activation. They form immune complexes. And this causes systemic as well as GI inflammation. And then this systemic inflammation, it circulates all over the body. So it can manifest as central nervous system changes, trouble with cognition or memory, focus, sleeping, anxiety, depression, anything related to that. It can cause inflammation anywhere in the body. Many times that manifests in the joints. Autoimmunity is big in chronic Lyme and tick-borne illness. Things like multiple sclerosis, rheumatoid arthritis, inflammatory bowel disease, all can occur because the immune system has gone awry. And then again, the malabsorption. Okay, so our nutritional status, which starts with a healthy diet, is a major driver of health or disease in the treatment of tick-borne disease. And if you can remember anything, I'd like you to remember this slide, because the important point is that the foods that we eat can trigger any of the symptoms that we have with Lyme disease. So a lot of times we might think, oh my God, my Lyme's coming back, I'm getting these symptoms, or I'm having a Herxheimer reaction because I feel so poorly. And you know, it manifests differently in everybody, but there's some similarities. But the foods we eat can actually trigger any GI symptoms. So when heartburn, nausea, diarrhea, constipation, etc. And that's kind of self-explanatory, and that usually happens fairly quickly. But these immune complexes don't always cause issues right after you eat the food or even the day after. It can take up to 3 or 4 days and sometimes longer for you to get that brain fog or the fatigue or headaches or insomnia, allergies, sinus congestion, joint pain and swelling, anything that you know to be related to your experience of this illness can happen from food. So be aware of that, and know that it's something that you can actually have some control over. Okay, so this is just an article that I wanted to bring up that says there's recent evidence suggesting that diet can cause dysbiosis, which is the gut microbiota, and lead to aberrant immune responses. It's kind of what we just said, or what I just said. So let's just talk about food that can heal the gut. So first, what I'm going to do is just give a general overview of some practical advice that I give to patients, and I try to follow myself. Choose food that is fresh, homemade, whole food. So you can limit processed foods, which can have preservatives and additives and chemicals and GMO or genetically modified things that our bodies just don't know how to process. They're not real foods. They don't nourish us. They probably cause inflammation. The next thing, like Hillary said, is about 10 servings of multicolored vegetables and fruits a day. And that's like 1 cup raw is 1 serving. And that would include vegetables from every family, the deep green leafies, the multicoloreds. Mushrooms are good for immune support. Cruciferous vegetables and allium vegetables are good for detoxification, as well as for acting as a prebiotic that can nourish your microbiota. And if you can't buy organic because of monetary reasons, then go to the Environmental Working Group's Dirty Dozen, ewg.org, and just don't choose those foods because they have more pesticides than others. So organic grass-fed pasture-raised meats are good, poultry and eggs, wild-caught fish, and the reason I say not to have farm-raised fish is they tend to have more toxins in them. Healthy oils would include extra virgin olive oil, fish oil, nuts and seeds, as long as you're not having any intolerance to them. And then cooking oils that have a higher smoke point include coconut oil, avocado, macadamia nut, and ghee. Bone broth is great, especially for patients who do not have an appetite or have an altered taste because of either the antibiotics or the illness itself, the tick-borne illness itself. The bone broth can really nourish the gut, and it has a lot of minerals in it. And you can put other things in it, meats or vegetables if you feel like it. Fermented foods as tolerated, and then a liberal use of the herbs and spices, some of which Hillary talked about. The ginger and turmeric are great for great to reduce inflammation. Yeah. Rosemary, cilantro, and parsley are good for detoxifying. And similarly, cloves and peppermint have their benefits. Ginger, by the way, is also good if you have nausea associated with any of the antibiotics or treatment. And as Hillary said, drink adequate water. What I consider that to be, or the fluid, non-caffeinated beverages, about 1/2 your body weight in ounces, 1/2 your body weight in pounds in ounces per day. So if you weigh 200 pounds, that would be 100 ounces per day of things like filtered water or spring water, mineral water, herbal teas, bone broth, things like that. And then chew the food until it's liquid in your mouth so that you can absorb it. And sit down to relax, breathe, and eat, only because that stimulates your parasympathetic nervous system, and that helps you to rest and digest. Okay, a few foods that are potentially harmful and inflammatory in the treatment of Lyme disease. So I would recommend that everybody with chronic tick-borne disease avoid eating wheat, gluten, refined sugar, processed foods, and some of the sugar substitutes, which can either be directly toxic to the brain or cause disruptions in the gut microbiota. If joint pain and swelling is a predominant feature of Lyme disease, then other foods that can be contributing are dairy, nightshades, such as tomatoes, peppers, eggplants, white potatoes, and possibly things like nuts and beans. And if you're someone who has histamine-related symptoms, things like POTS or mast cell activation syndrome, or if you get a lot of headaches or palpitations, low blood pressure, skin rashes, then watch for, I wonder whether those V's got there, watch for things like bone broth and fermented foods, because they can actually they can cause a histamine-like reaction, and you just may not be able to eat them at this time. Okay, so one of the best ways to know if you're currently reacting to a specific food is to do something like an elimination diet. It's tedious, but it really can help you decide as an individual what you can handle and what you can't at this point in your life. So for 30 to 60 days, you would exclude inflammatory foods like wheat and gluten, dairy, eggs, soy, corn and corn products, and sugar, and I'd probably keep that one out altogether, and possibly nuts, beans, and nightshades. And then reintroduce one food at a time, eat it fairly liberally as long as you're not allergic to it for about 3 to 4 days, and keep a diary of your symptoms. And if you get any symptoms whatsoever, it doesn't have to be gastrointestinal, it can be headaches, it can be brain fog, it can be fatigue, it can be joint aches and pains, then that's a food, at least for the time being, that's something that you would probably feel better with if you would avoid it. And then wait until the symptoms resolve, and then add another food in. And keep the diary so you know and you can remember what's going on. This is a template of the paleo and autoimmune paleo diets. And this kind of serves as a good template for those who have tick-borne disease. It eliminates most of the inflammatory foods. The literature supports its ability to decrease inflammation, immune triggering, as well as autoimmune activation. It's mostly vegetables, as we talked about before, with some good proteins, fruits and starches, healthy fats, herbs, etc. They do include organ meats too, which to some is kind of difficult to overcome. I guess organ meats do come in capsule form. But anyways, this is probably one of the most beneficial diets I've seen in the treatment of Lyme disease with most patients. These are some resources if you want to learn a little bit more about it. I find the paleomom.com actually has awesome information. She's a researcher, and she just goes into detail about the research behind diet, the research behind the paleo diet, and how to do it. But the difference between the autoimmune paleo diet and the paleo diet, by the way, is that the autoimmune paleo diet excludes things like nightshades, nuts and beans, as well as eggs. Unfortunately, eggs tend to be fairly inflammatory for some people, whether it's the whites or the yolks or both, but they are such a beneficial source of nutrition that sometimes they have to be excluded in the diet for at least a period of time until the gut heals. And there are various protocols for healing the gut. I don't have time to go into that today, but eating the right foods that don't inflame the gut is one of them. This is the Whole30 diet. There's a book called It Starts With Food. That's if you're interested in more of a selective type of elimination diet. Okay, so in summary, an anti-inflammatory elimination diet, which does include the paleo or autoimmune paleo, it actually could be your best friend when you're going through the experience of tick-borne illness. It requires commitment, but it's well worth the effort. Managing our diet is one point of leverage that can help us to feel better. It can improve our nutritional status. It can decrease the immune response that gets over-exuberant and causes so many symptoms that we attribute just to our Lyme or to Herxheimer reactions, and it's something we actually have some control over. All right, so I saw some faces out there, and I see this a lot from my patients. I mean, yeah, it's like, what, I can't eat my wheat anymore, my ice cream, what are you talking about? And I get it, because we have established these patterns for the last, years and decades, and it's hard to break them. And then to add insult to injury, we don't feel like eating anything because our taste is off or we have nausea. So I get it, but it's well worth it. And I hope that you were able to take one thing away from here today that maybe will benefit you in your journey with Lyme disease or your family member or friend's journey. And the next time we run into each other, you'll be like this little guy. All right. Thank you very much.